Snoring is a common problem, and there is a simple solution. Welcome to Lifestyle Stalkers. In this video you will learn more about how can a mouthpiece prevent snoring. Before we start, make sure you subscribe to our channel, and click on the bell so you won't miss any of our lifestyle videos. The incidence of snoring appears to be increasing. Medical scientists and dentists have discovered that a snoring mouthpiece can help prevent snoring sounds and alleviate some of the medical problems of obstructive sleep apnea, OSA. This disruptive social and medical problem is directly associated with the obesity epidemic. So not only are we becoming fatter, we are becoming louder during sleep. Almost everyone with OSA snores, but some people just snore and don't have OSA. The difference between snoring and OSA is important because OSA is linked directly to heart disease, strokes, sexual performance problems, excessive daytime sleepiness and work and auto accidents, snoring, headaches, GERD, diabetes, depression, RLS, Alzheimer's, gasping and choking during sleep and other problems. What causes snoring? The sometimes very loud noise of snoring is caused by the vibration of the soft tissues in the back of the throat when the body attempts to overcome any airway blockage or obstruction during sleep. The smaller the airway, the harder the body must work to overcome the obstruction, hence the vibration and noise. The muscles in the roof of your mouth, tongue and throat normally tend to relax during sleep. If there is enough air moving by these relaxed tissues, they will vibrate and cause the snoring noise. The stronger the airflow and greater the effort to breathe in, the louder the noise can potentially become. Who snores? Although most snorers tend to be overweight, you do not have to be overweight to snore. Some thin people snore because they may have a blocked nasal passage, or their palate may be large or have some other structural airway problem. Extra large tonsils can also be a cause of snoring. Men are generally more likely to snore than women, and snoring also increases with age. Snoring can be exacerbated by a number of factors, including increased alcohol consumption or sedatives, both of which relax the airway tissues. Certain anatomical variations of the throat, nose and mouth may also influence the snoring incidence. Age and gravity cause the tissues to droop. When the airway is stiffer, there is less resistance to maintain the required airflow and the snoring will be less. A snoring mouthpiece can stiffen the airway. Individual anatomy, age and lifestyle choices tend to be the primary causative factors. How loud is snoring? Most snoring is louder than light highway traffic, about 40 decibels, while the average is 60 decibels. The loudest snorers have volume equivalent to a loud yell around 82 decibels. The Stop Snoring Mouthpiece. The snoring mouthpiece is a popular snoring solution. You may try some self-help aids such as nasal sprays, nasal strips, losing weight, and yet you still snore. Surgery is advocated by some as treatment for snoring. However, this is not always effective. Patients with OSA and snoring are often treated with a device known as a CPAP machine, which is a respirator-like mask fitting over your face and nose while you sleep. The CPAP blows air into your nostrils during sleep. However, many patients dislike this cumbersome device and look to try a simpler solution. You might want to try a snoring mouthpiece to see if the noise stops before these other dramatic solutions such as surgery. Some people want to try the mouthpiece as an alternative to CPAP, if you have been diagnosed with OSA. These mouthpieces can be made by your dentist or from self-fitted kits available on the internet or various retailers. Many of these mouthpieces are known as boil and bite mouthpieces and are fitted in a manner similar to the common sports mouthguard. Check out our video description to see recommended and affordable mouthpiece. There are two types of dental snoring mouthpieces. One type advances the lower jaw, which pulls the tongue forward, directly opening the airway. This snoring mouthpiece is known as a mandibular advancement device, MAD, which also stiffens the airway to help improve airflow. The second type of device pulls the tongue forward and is known as a tongue stabilizing device, TSD. Although the TSD requires an adjustment period, it can be worn by anyone, even those without teeth, gum disease or persons with jaw joint problems. These devices are worn during sleep. Both of these snoring mouthpiece types are safe, effective and are economical if purchased online. As with all user-fitted devices, it is critical to follow directions and instructions from the manufacturer. Are you ready to get your own mouthpiece? Check out our recent clip as well here in Lifestyle Stalkers. Be sure to subscribe and ring the bell to be notified about our latest videos.